Dr. Walensky, if you don't mind, retrospectively, what do you feel the impact of lockdowns were on mental health in this country?
It's certainly the impact of lockdowns resulted in lives saved from COVID-19, and also challenges in connectivity. And there are reports of some children doing better in school at home, but also some children that are losing.
My question is mental health.
Yeah, right, and the lack of connectivity and challenges in mental health. And we saw increases in mental health challenges before the pandemic. They were rising before the pandemic, and certainly the pandemic.
So you're saying the lockdowns had no impact on mental health?
No, I'm sorry, I'm not saying that. What I'm saying is that the impact, when you lose 1.1 million people in this country, there's tragedy, there's loss. There was loss of lives, there was loss of housing security, food security. All of these things impact mental health.
Dr. Walensky, we've had a conversation several times in the past. Of course, we're lifting the federal vaccine mandate, the public health emergency here on May 11th. I'll not forget easily all the angst that was out in the small business community when we had to put a Congressional Review Act out to make sure you weren't going to force vaccines on employees down to employers of 100 employees. That had more fright when it was in the rearview mirror and it was coming down, and it took the Supreme Court to come in and thwart that bad idea. I'd like to know if that was your recommendation, Dr. Fauci's. It was the Biden administration that did it. Who was going to push forward that was a good idea before we had to come in and intervene with a Congressional Review Act and then get the Supreme Court to weigh in?
Yeah, maybe what I'll say is here we are now in 2023 when we have 96% of people who have protection by one way or another, either prior infection, or by vaccination. At the time, we were seeing our workforce and police departments, first responders
This wasn't that long ago. This was just last year where you had maybe it won 96%, but when you and I had a conversation, we knew that it ravaged the elderly. And it was clear that it wasn't going much more deeply into the rest of the population. And the trillions of dollars that we spent and the fact that the economy was shut down for that long, I think that was much slower to react to the real science and maybe not the political science. And I'm just wondering if you and Dr. Fauci and who were the ones that kept pushing forward on that one issue of the vaccine mandate for employees, private employers down to 100 employees.
I can tell you that there's a group of us that advises the president on these presidential proclamations. I will also say that to this day, we know that our bivalent boosters still have 2.7 times the protection against death if you've gotten the bivalent boost than if you haven't. So we still know that these vaccines continue to provide protection for people across all age demographics.
Thank you. And by the way, Dr. Fauci in the last interview said that he would probably never recommend shutting the economy down again for something similar to that, FYI.